right, Matt. The flu is what we're talking about in this morning's What's Going Around. Dr. Jason Sevald is an ER physician on staff at Palm Beach Gardens Medical Center. Thanks for joining me. You just watched that story with me. Have you ever heard of anything like this? You know, complications from the flu leading to blindness. It just breaks my heart.
It does. I've never heard of a case of blindness caused by it before. Certainly, we know any viruses can sometimes get into the central nervous system and cause CNS infections, and those are usually the most severe cases. One leading to actual blindness before. I've not seen that particular outcome.
What is the status of the flu in Florida, and specifically, can you tell us anything about our area, how it's spreading, this, strain B we just heard a lot about, update us.
All right, we're seeing flu. We're seeing it on a regular basis in the Palm Beach Gardens emergency room. I'd say we probably have 1 to several cases a day that we're diagnosing. It's mixed A and B. I have not noticed a particular prevalence of one versus the other, but we're certainly seeing it.
Much like we just heard from that mom, do you feel like people don't realize they have to get vaccinated every year?
It goes by so fast, right? We get so busy, especially you're coming up on the holidays. We've got so many things to do. It's hard to keep in mind and remember, oh, it's that time of year again. I need to go get this year's vaccine. At the hospital, it's easy for us because they have somebody coming around and saying, hey, it's time for the new vaccine,
Sure.
You need to get it done.
Sure.
But
is there an optimal time to get the flu vaccine? I know it's available now, but, is there an optimal time where you should get vaccinated in this window, or, tell me a little bit about that.
Pretty much once they come out with the new series of vaccines for each given year, the sooner you do it, you might as, the more time of protection that you get, you have a chance of being infected at any time. So the sooner you have the vaccine,
Sure.
then the better.
And it's out now.
It's out now.
So aside from the vaccine, which obviously doctors and, experts recommend, what other precautions should we be taking right now? I know we hear about them a lot, to prevent the flu, but, a timely reminder nonetheless. What should we know?
Hand washing, right? But the biggest spread is touching something that somebody who's infected has touched. So
Sure.
whether it's door handles, your keyboard, your mouse, any sort of secondary object is actually the most common way of viral transmission.
Sure.
So, and the way you prevent that is before you touch your face or your nose, wash your hands.
Sure.
So the more hand washing you do, the better.
I wash my hands all day.
So do I.
One more question before I let you go. Some years we hear that the vaccine is less effective than other years. What can you tell me about this year's strain and what you know so far about how effective it is?
I don't have any particular data so far on the effectiveness for this year's strains and the most common ones that we're seeing right now. But what I can tell you is it makes a difference. Even it does not absolutely prevent you from being able to get the flu, but people who have been vaccinated and get the flu tend to have a shorter duration of symptoms and not as severe. So it's worth getting either way, whether it helps you prevent it or from not having it as bad. And because it's miserable. People are miserable for at least a week.
Sure. And
anything
hopefully
you can
not
do,
worse.
And hopefully not worse.
As we saw. Dr. Sevald, thank you for being here. Really important, timely information. Thank you. Matt, over to you.
All right, great stuff. Thank you very much. All right, well, so if you know